Hi, when we talk of safe cosmetic or aesthetic surgery, we are really looking at a few important factors. What are they? First and foremost, you must have a good and satisfactory outcome. Secondly, you must have good value for the money and the time spent. But most important of all, it should be very safe. So what are the really important factors that go into it? Whatever be the reputation or the size or the name of the institution that you're going into, the most important factor is going to be the experience of the surgeon who's going to be treating you. So it's well worth doing a bit of research into the experience of the surgeon whom you're going to consult and who is going to manage your condition. Secondly, you must have a very clear idea of what you think is wrong with you and what you think that you really need. When you are able to be clear in your approach, it becomes easier for the surgeon to give you options and good options. Next, it is not only important to have a good experienced surgeon, it is also important to be safe. So the infrastructure of the place, other than the cosmetic surgery part, is also important. Why? Because in the best of hands, in the best of places, at the best of times, sometimes things can go wrong. It is not that things will never go wrong, but the most important thing is when something does go wrong, does the surgeon and his team, the anesthetist and so on, and the hospital that you are going into, do they have the necessary expertise and infrastructure to get you out of the problem? This is the most important thing. And quite often, one is paying for a bit extra for this kind of thing. Last and not the least, it's your comfort factor. You should be really comfortable with the surgeon who is going to manage you. It is well worth going again for a second consultation, if need be, maybe even for a third, as many times as you need to go to make sure that you and the surgeon both understand the problem clearly and that you're both on the same page as far as the treatment is concerned. In fact, I would go so far as to suggest that you go and get a second opinion and a third opinion. Most experienced surgeons do not mind you're going and getting a second opinion. It only reinforces what they would have already told you. So, summing it up, what is important is the experience of the surgeon, your satisfaction for a good outcome, and safety. All these are very important to have a satisfied you.